laparoscopic sleeve gastrectomy and laparoscopic room-wide gastric bypass, weight loss with the two procedures. So we know from many publications that have looked at weight loss with the two procedures how much weight patients will lose on average. And we know with the laparoscopic room-wide gastric bypass that on average patients will lose about 70 to 75% of their excess weight. Whereas with the sleeve gastrectomy it's a bit lower at 60 to 65%. But what does that mean? So the excess weight is really how much heavier a patient is than they should be. So if we take a typical lady who might come into clinic whose ideal weight is 10 stone and she weighs 16 stone, her excess weight is 6 stone. So on average, if she had a laparoscopic room-wide gastric bypass, she would expect to lose 4 to 4.5 stone, whereas a sleeve gastrectomy is probably 3 to 3.5 stone. But patients aren't all average. Some patients will lose less than expected, some will lose more than expected. So when we see a patient in clinic, we look at all their different characteristics to try and see if they will be an average weight loss or an above average weight loss. And the characteristics we're interested in are their age, their body mass index. If they're a larger patient, they will need to lose more weight and a room-wide gastric bypass may be better. If there's somebody who has a slow metabolic rate, who really finds it very difficult to lose weight, then again, their weight loss with a sleeve gastrectomy may be below average. In the next part of this series, I'm going to talk about reliability of weight loss with the two procedures and the risk of weight regain, which is probably a feature more of the sleeve gastrectomy than the room-wide gastric bypass.